Welcome back to Bloom. I'm with America's tech champion, award-winning tech journalist, Kurt the Cyber Guy. And Kurt, more and more people are turning to AI when it comes to diagnosing themselves.
Undoubtedly, because it's compelling. You go and you have an ailment suddenly and you're like, wait a minute, should I, and you've Googled it already, like, wait a minute, should I try this ChatGPT thing? And so we do. And for example, I was just in Aspen, and we got winded, and we were taking, I can't remember that there's a drug that you take when you go to high altitudes, you take it a couple days in advance. So it didn't seem to be working. So ba-da-da-da-da, why isn't this working? And guess what? It came up with some really good personal medical advice. Should I have followed it? Probably not. I should have called my doctor or reached out somehow. But you know, it's so hard to get in touch with our doctors now in the way America's health system works. So I went with it. I got a humidifier. That was one of the recommendations, and it worked. I mean, I didn't feel like I was crawling out of my skin like I was at that high altitude. And then, what else did I do? Oh, we bought the little cans of oxygen at the hardware store.
Yeah.
And
how'd
honestly,
those work?
Well, you would just take a few puffs, and it was as if we were doing drugs. I said, this is like a marijuana bong. Like, no, it's not. It's oxygen. And so you do that quick hit, and then you set it down, and then, okay, now for the next 15, 20 minutes, you feel normalized, but it comes right back.
It's interesting. Now, I was asking you in our pre-production meeting, I'm like, how is this different than Dr. Google? Because I've been Dr. Google for years now, but you say it's different when using AI.
You know what I would do? I mean, the best way to use AI is to verify what your doctor is already telling you, and also to verify test information. Like, for example, I just went and had my physical, and I took that data of the blood results, and granted, I'm running a risk when I put it on there because it's not necessarily private. So I took my name out, but they still can figure out that it's me. But I put it in there, and I see, you know, what does this mean? It says, oh, well, your good cholesterol is high. It's what you want. And then it gave me other guidance, like you probably want to hydrate more. It seemed that it was telling me that I was dehydrated. So I got information out of it, which then allowed me to have a more educated conversation with my doctor. And I figured out that if I got bad info from ChatGPT, that my doctor would at least catch it. Because I just said, hey, I use this. Instead of saying, hey, I talked to Dr. Google, I say, hey, I talked to Dr. ChatGPT. At the end of the day, I don't think you ever want to turn to that for some critical, life-altering kind of stuff when it comes to your health and medical. But boy, it can really shape a great conversation with a true health professional.
That's interesting. So Kurt, what you're saying is that we need to use this for our advantage. Like, for example, and we talk a lot about this on Bloom, about you don't have to just accept whatever diagnosis you've been given. There are a lot of ways to reverse it. Like, I got a bone scan and ended up having osteopenia. So I was able to do all of this research and then go to my doctor, and then a year later, year to year, it actually reversed the bone deterioration and started building bone back. So there are ways that it could help. And like you say, I think so many of us get nervous when we go to the doctor. We've got 15 minutes in a traditional format. If you come with a list of questions that are thought out.
The low-tech answer to a great doctor's visit is to use this technology in advance to come up with those smart questions that you did. But bring that old-fashioned spiral notebook or just piece of paper and a pen in there. It's amazing how a doctor treats you differently when you're writing notes.
Right.
When there's accountability in that exchange. And sure, we may have visits where we feel rushed, but boy, you just say, I've got questions, here they are. Most doctors really appreciate you coming in with smart questions. And oftentimes you can teach them something new, because they're saying, you know, I don't know about that, but let me get back with you. And they do, in my case, because I've needled them to get my answers back. But you know, I think it can be really helpful.
I do too, because I think in the healthcare system today, we're so grateful to have all the incredible doctors that we have, but they're seeing huge caseloads of people. So the more that you can do to help them out and become your own patient advocate, this is when technology works for you and not against you.
Right, and I would say also, like, one of the best tools in today's medicine that I've been able to use is just going on. Epic is the background, it's sort of the backbone that hospitals and medical centers use to store our data, to communicate our information from one doctor to the next, to allow you to access your test results. Because today, your doctor doesn't necessarily call you and say, oh, by the way, I got your results and here they are. you're usually having to chase them down. And I would download the app to whatever medical organization you're a part of or your doctor's a part of. Log in there, make that password as big and dangerous and strong as you can, so that that information is always at your fingertips. And that'll give you greater access to your doctor to ask those kind of questions, and also to be able to see test results that you don't get because maybe your doctor didn't tell you fast enough.